outside speaker today is Dr. Walden, who is the current president of the Georgia Medical Association, and who's going to come to us today and talk about health disparities specifically in our community and what can be done to eliminate those. So, Dr. Walden, whenever you're ready.
It's a pleasure. Thank you very much. As she mentioned, I am a family physician for the past 20 years and currently president for the Georgia State Medical Association. And one of the agendas for my itinerary for the next few years as president for the state of Georgia's Medical Association is to see what we can do to decrease the number of health disparities that we as minorities face on a daily basis. And I'm sure all of you know that we have nothing if we don't have our health. One of the most tragic impacts in health disparities in our community is the disproportionate loss of life and suffering that many populations experience. This is a major impact when it comes to health disparities. The ability to be self-sufficient, the ability to earn a good wage and be productive citizens relies on having good health. When populations are disproportionately unhealthy, we're unable to maintain steady employment. We can't contribute to society, and we are likely to depend on others for support. So good health should not depend upon a patient's ethnicity, how much money they make, where they live. Every American in this country deserves the right to health care of high quality. So we have got to end the unequal treatment, heal the hearts that continue to see patients as colors and not fellow human beings, and expand our vision to health care, thus eliminating disparities in our communities. So what are the objectives we're going to talk about? First of all, what you need to know and what you need to do. Simple. Serving to eliminate those healthcare disparities, removing barriers of access for minority groups such as many of you sitting here today, promote the prevention and health lifestyle changes, and encourage cultural awareness and sensitivity among caregivers, community groups, policymakers, and have collaborative partners in our community. So what are these healthcare disparities we're talking about? What exactly is it? The National Institutes of Health defines it as differences in health status among segments of a population, whether it's by race, age, sex, family structure, educational level, income, job, disability, and living in those various geographical areas. Now in the United States, there are 300 billion people. 77% are white, but only 13% are African Americans. And 17% are Hispanic. So guess what? We're no longer the majority minority anymore. Hispanics outnumber us now. Physicians in the United States, there are approximately 800,000 physicians, black, white, Hispanic, Asian, you name it. However, African Americans in the United States only account for 35,000. That's a serious problem. And when you look at Georgia, which has a population of 9 million people total, 62% white, 31.4% African American, and 9% Hispanic, physicians, African American physicians only account for 3,000 of those people. Serious problem. We need more of you to go into medicine. We need you to increase the pipeline. I can say that I have served as director for the Griffin Jordan Medical Society MAPS chapter here back in 2005 up until about a year ago, helping students here at Albany State get into medical school after students came to me stating they weren't getting in. And I simply applied the knowledge of what I knew, of what it took for me to get in, to help those kids by taking them to the medical schools throughout the country and having the deans come here to interview and meet with them. And also doing workshops on what it takes to get into medical school, what the interview process is going to be about. So I'm hoping to get that reignited again this year. But we've got a lot of work to do, people, and we need many of you in the healthcare industry. So what are the leading health indicators that lead to these disparities that we see? Many of them, as you see here listed, obesity, stress. Stress is one of the biggest problems that we see. As a physician, stress is, when patients come to my office, over 70 to 80% of the patients that come is related to some kind of problem of stress. Whether it's stress at home, stress on the job, stress just dealing with everyday life, okay? Many doctors don't take the time to listen to their patients, and that's a lot of problems we see among minority groups. They go to the doctor who's not black, many of them, and they say, the doctor says, well, what are you in for today? Well, doc, I'm not feeling good. I got a headache. I can't sleep. I'm just going through a lot right now. And many times he's sitting there writing on his prescription pad what he's going to give you, instead of looking at you in the face to see what all is really going on. And when you look at a person and you listen to a person, you can pick up a whole lot more by just taking a few minutes. And so as a result, I have learned through experience that many patients who come to me, they come because they weren't getting the proper treatment from other physicians. And this is a serious problem. There are cultural barriers, and I'm going to explain some of that to you. You're going to be shocked at what patients interpret certain expressions when you tell them what's going on with them. So sexual behavior, mental health, violence, not getting the immunizations they need, and most importantly, having access to health. What about our life expectancy? How has it changed over time? Well, in the early 1900s, most people didn't live to be 50 years old. Since 2002, the age has increased because we have better medications, we have better medical technology, and people are trying to be healthier. So therefore, the age has increased to the average age of 75. But guess who's dying sooner than any other person in this country? Black men. Just this week, I had 2 people come to me to tell me that their spouses or family member died of a heart attack. Today was the latest one, 43 years old. His wife came home from work this morning. He was in bed, and she thought he was sleeping. He was dead. He had a massive heart attack. He had suffered with high blood pressure, 43 years old. Had suffered with high blood pressure, and it was hard, I guess, to get it controlled. We don't know how his diet was, what he was eating. And folks, you know, we as African Americans, we love good food, don't we? Yes, we do. And fatty food, and fried food. And a lot of us eat a lot of pork in our diet. And it just goes all the way back to slavery, because you have to remember, see, you got to know your history. Back in those days, we didn't have steaks and fish and a lot of good meats. We had to eat whatever they gave us. And I used to hear my ancestors, many of them talk about slop, that they would give pigs. Many of the slaves had to eat that same stuff after they worked in the fields. So they learned how to cook that pork so it could taste good. That's why so many of us eat it, and we shouldn't, because that is one of the #1 killers of our race today, is eating too much pork. And I'm talking about fatback, ham hocks, and hog jaws. And don't be looking like you don't know what I'm talking about, because you do. You know, when the holidays come around, that's what grandmama and mama gonna put in those collard greens and turnips, okay? Can't have it. We have to stop. We have to change our diets, people, because it's killing us. What else is killing us is the salt in our diet. We eat too much salt. Many of those foods, when you go to get fast foods, they're loaded with salt. Why? Salt is a preservative. It is what helps keeps food fresher tasting, so they can keep it in their restaurants longer and don't have to spend as much money replacing it. So black men, you have got to take an initiative to take better care of yourselves and encourage your brothers out there to do the same. So they exist in due part also healthcare disparities to racism. Yes, long time ago there was a Tuskegee experiment, I don't know if many of you are aware, where they tested many of our African American men by injecting them with that bacteria, that syphilis, that parasite, to see how they would react to it. Patients had no idea what they were getting. They thought they were going to get better. Many of them developed the 3 stages of syphilis. First the infection, then it goes latent and you don't see anything, then the next thing you know it's gotten to your brain and it causes neurological problems. So, and not only that, I have had deans of medical schools, colleagues of mine, who have had many of their family members who were mistreated when they were little, growing up. They've even seen their family members die, sitting in the emergency room with an emergency that needed to be looked at right away. But because they were black, they let them sit there and die. One had a ruptured appendix. He was febrile, he was sweating, he was just hurting, he was bent over. He sat there for hours while his family tried to do what they could to calm him. And he died because no one came to his rescue in the hospital, okay, in the emergency waiting room. So many African Americans they still hold these things within that mistrust when they go to doctors. So if a doctor says, well, Sarah, you've been diagnosed with cancer and we're going to need to do surgery to remove that tumor. And tumor surgery? No, that means cut. They don't trust. So they say, no, I'll live with it. And many of them die before their time. You don't have to do that anymore. Times have changed. Technology is so much better. Doctors are a lot better. And yes, some doctors don't do all of what they should do for you. That's why there are so many others that you can go see. So when you don't like one, just see who else is out there that can help you. You don't have to stick with that same one. HIV/AIDS is something that you young people need to definitely take a close look at because it's affecting you. Notice I have the epidemic is mostly in the 34 to 44 age group. Well, that's because that's by the time they get the disease, it's taken over their body. That's how old most of them are. But guess what? They got it when they were in high school and college, by having unsafe sex, by not wearing condoms, by having multiple partners. African Americans are the largest group of people in this country. There are 1 million cases of AIDS in this country. We only account for 13% of the United States population. And yet, half of those cases are our people with AIDS. And the sad news I have to tell you, it's not just 1 million, it may be 2 or 3 million, because there are so many people who are walking around here who have not even gotten tested. So if we decide to have a health fair with the Griffin Jordan MAPS chapter here on campus, and we say we want to do HIV testing, don't act like you so healthy that you don't need to get tested. At least know for a fact that it's on writing that you are negative. Getting tested doesn't say that you're positive. So get tested. Don't be ignorant, because that's what's happening. People are running away from the truth and not wanting to know whether they're positive or negative. Young people, get tested. Even the health departments will do it free of charge.
I'm going to plug in Albany State University Student Health Services will be testing for HIV/AIDS on November 13th.
Thank you. November 13th, get tested and encourage your colleagues to do the same. Know your status. And I have to also admit, I have a lot of young people come to me as patients with STDs, gonorrhea, syphilis, trichomonas, herpes, you name it, they got it. And the sad news is they go with these men, these young boys, some of them men, whatever, and instead of wanting to know more about their past, you got to remember, when you have sex with someone, you're having sex with everybody else they ever had sex with, whether you know who they are or not. So if you don't get to know your partner and know some of how many partners they've had in the past, and even if you can know who they've been with, because sometimes if you know who they've been with, you know what that person's got, and you certainly don't want to go with them because you may get it too, okay? Not everybody goes to get treated. When one partner gets a STD, the other partner may not ever go get treated because he doesn't know or she doesn't know they have it, okay? So,
chlamydia gonorrhea testing will be that Monday.
Okay.
HIV is that Thursday.
Mhm.
Monday the 10th will be chlamydia.
So you all have no excuse. Nobody has an excuse to walk around here with STD. You got everything you need right here to get taken care of. What are the language barriers? Now this is a good one. I like this slide because when I'm talking to patients, I have to look at them to make sure they understand what I'm talking about. And I have witnessed and seen in many places that I have mentored doctors, helping doctors to do better medicine, because I was the Physician of the Year for the United States out of 35,000 doctors, black doctors, back in 2005. And so they had me to go around and talk about what I did that made my practice so good. But one of the things I find is that patients will sit there while you're talking to them and they'll nod their head and they don't understand a thing you're talking about because you're way up here. You got to get down to their level. Okay, so you as professionals, because all of you students in here are going to be some professional of something one day, make sure you break it down so that those who didn't go to college understand what you're talking about. Okay? For instance, Alzheimer's disease, which is dementia. We see a lot of that now. A lot of people are losing their memories. They can't remember as they get older, and it's getting to be younger and younger people in their 40s and 50s we're starting to see it in. But a lot of people call it old-timers disease, but it's Alzheimer's disease. When we talk about, this is another one, these last three, I had a 40, and this lady was only 44. Came to my practice and I was doing a history and physical on her, and I asked her about her sexual history. I said, well, how many sexual partners have you had in the last year? Oh, just two. Two? It's a lot, okay? Well, does your partner wear condoms? And she looked at me real puzzled. And she said, oh, you're talking about those condominiums. I said, no, darling, condoms. And then I went and had to go get and show her what a condom was, you know, and how it's supposed to be used, and making sure that the male uses it correctly, because a lot of them don't know how to use it correctly. So they break and they tear and they end up getting pregnant. But she didn't understand what condoms were. She thought it was called condominiums. Some people who especially come from the South, and I think it stems from slavery, because I had to go home and ask my mother. I had never heard anyone refer to a female genital area, such as the vagina, as the monkey. So when I was asking this patient about discharge, which she came in for, I said, well, are you having any problems, any pain in the vaginal region or discharge? She looked again, real puzzled. And I said, yes, down in your private area. Oh, you talking about my monkey? I said, what? So when I went home, I asked my mother about it. She said, you know, that's a term they used to refer to as the vagina way back during slavery. And it just went from one generation to the other. So educate your families. Educate each other about the body parts. Other expressions. I had an autopsy versus a biopsy, when they really had a biopsy. An autopsy is when you're dead, so you know you didn't have one if you're sitting here talking about it. Okay. Women who get their tubes tied so they don't get pregnant again, they call it a tubal ligation, not a tubal litigation. A litigation is when you're going to sue somebody about something. Okay. A colon trouble, when they're referring to their colon or intestines. Cologne is perfume or some kind of fragrance. So these are the things that you know that we'll see. They had a pep smear instead of a pap smear. So we have to teach each other the correct terms to use. So what are the chronic diseases that lead to many of the disparities in death? Well, in our country, heart disease and cancer are the two top problems that people have chronic diseases from. Cardiovascular disease and cancer, primarily lung cancer. Lung cancer is number one for men and women. Breast cancer is number two for women. But guess what? Out of all the women who have breast cancer, white women have the highest incidence of breast cancer. That means they have the highest new cases. But guess who has the highest death rate? Black women. They wait too late to get something done. Don't do that. When you turn 40, get those mammograms. If you have a history of breast cancer in your family, get those mammograms when you're in your early 30s. I start mine, I don't care if what's going on. If they don't even have breast cancer, I'll start them at 35, getting their mammograms. Okay? Strokes is number third of all the diseases, and there are higher percentage of all of this in African Americans and Hispanics. Infant mortality is highest among African Americans. In the United States, you would think with all of the medication, the type of specialists that we have to take care of children and mothers who are pregnant with expecting, that we can prevent a lot of these babies from dying. But guess what? We're one of the worst in the world. Even Cuba has a lower infant mortality than we do. Even Ecuador has a lower infant mortality than we do. And why? Because they have what we call universal health care. Everybody has insurance. So there's no reason for anybody to be going without or having problems. That's why November the 15th, the Obamacare second enrollment starts. Young people, you can get health insurance. All you have to do is go to healthcare.gov. I have students from other medical schools, other colleges, healthcare.gov. There's a phone number you can call them. Students only paying $25 a month. Okay? Get covered. It's a mandated law that you must have health care insurance. Now, if you have it already on your parents' policy, that's fine. But if you don't have it, you're gonna suffer a penalty charge, and they're gonna take it out of your IRS, whatever you're getting from the IRS. So they have a way of finding out. So don't lie when they call and ask you how much you make. If you're working and you're getting a salary, they know how to check, because they go. It's all part of the federal government. What are some of the risk factor differences? People who smoke. Had a patient today that I saw earlier before I came here, recently was just diagnosed with lung cancer. He had been told he needed to stop smoking years ago. He's now 74 years old. Now he has it. These are preventable diseases. Stop smoking, don't drink alcohol, don't use drugs, and you can prevent a lot of things from happening to you. Don't eat a lot of pork and salty foods and fast foods and junk foods and greasy foods and fried foods. You won't have a lot of problem with high blood pressure and diabetes, because that's what's leading to all these issues with disparities. Too many African Americans are having these problems because of our diet and our lifestyle. We have got to change that, people. High blood pressure and high cholesterol are the leading causes. As I mentioned, salt. For some reason, African Americans have a higher salt sensitivity. So I can see a patient today and their blood pressure is doing really good. They're eating right with their fruits and vegetables and limiting their starches and stuff. Not drinking sodas, but water more so. Then they come in after the Christmas holidays. Pressure's sky high. 180 over 100. Well, what have you been doing? Oh, I don't know. That's not an answer. What have you been eating? And they know that I know what they've been eating. The wrong foods. And most of it is pork. Yes, we had some chitlins this past Christmas. Please, don't eat that stuff. It's going to kill you. What it does is it clogs up your arteries. It causes plaque buildup in your vessels. That's what leads to hardening of the arteries, or atherosclerosis. That's what leads to coronary artery disease, and when people have heart attacks. That's what leads to strokes. Those plaques build up in those tiny little vessels. See, you got little vessels in the brain. It doesn't take much plaque to build up there to cause a stroke, okay? So we see more African Americans, more Hispanics in the emergency room as a result of all these problems, because they're not doing what they need to do. And no one has educated them. No one has told them, because they haven't had access to care, many of them, to get the right information. So the emergency rooms are flooded with people with no insurance. Why? Because if they don't have insurance, that's the only place they can go. The emergency rooms can't turn them down. Okay? But what does it do to our economy? It increases the cost of health care in our communities. And we as taxpayers pay for that. Okay? Now, as I mentioned, Medicaid expansion is an important issue. If you're not sure what that is, what it is that yes, we have many people who are on Medicaid. But since the Obamacare marketplace health insurance has come about from President Obama, there's my friend back there, we are trying to get Governor Deal to expand Medicaid. I met with him a month ago. And that was the first thing. The second thing on my agenda, the first was to put some blacks on the state medical board, because we have none that help license doctors, and that was the first thing we were able to accomplish, as I recommended some people that he finally selected. Secondly was to meet with him to get him to expand Medicaid. What is Medicaid expansion? The president, the federal government has offered every state in the United States millions of dollars to help people who fall under the poverty level. That is, people who make less than $15,000 a year. And he doesn't want to take that money. So he's letting it sit there, and someone else is going to get it. So we have over 600,000 people in Georgia who fall in that category. You know what? Many of them look just like you and me. And so when I talked to them, they said, well, we don't believe we should be helping people who are sitting on their laurels doing nothing. I said, how dare you say that? I can bring you patients right here today if you'd like me to, that work every day, that still make less than $15,000 a year. And they can't afford insurance even though their company may give it because the premiums are too high. It's more than what they get paid. So this Medicaid expansion is to help those people so they don't have to worry about paying for insurance, okay? But he doesn't see a need to. Well, I'm standing here today to tell you November 4th is election day. November 4th, we have 2 people running for office for the governor. And I hope you all will make the right decision to vote for the right person in that office. I'm voting for Jason Carter. Okay? Are we our brother's keeper? We must look out for those less fortunate. Those of us sitting here today who are blessed to be in college, blessed to have a job, we must look out for those less fortunate and help them in some way. We have got to stand up and be an advocate and be a voice. We cannot sit and be complacent. That's why disparities exist in our country. Too many of us are not doing what we can do in our communities, and hopefully by the end of this talk, you will know what you need to be doing. Infant mortality in Georgia is really bad. This is the amount of deaths that we see of infants that die before their first birthday. Why? Because of the following: birth defects, born premature. We see many young girls, many of them teenagers, they don't get prenatal care, they don't go see the doctor when they find out they're pregnant. Many of them, they don't even know they're pregnant until they're about 2 or 3 months, you know. And sometimes they've been abused. Sometimes there's violence in the home going on, and they don't follow up with their appointments with the doctor like they should. And so, as a result, we see a lot of problems with babies dying before their first birthday. Lead levels. Why do they have blood lead levels that they have to check? Many children grow up in poverty, live in homes where the paint that was used is still there from years ago that was lead-based. This lead gets into the water that they drink. It's in the environment where they sleep. Some kids even eat paint chips with lead in it. So as physicians, we do have to check lead levels, but not all kids come to physicians to get this checked. So they end up dying, or they end up with some neurological problem. What else? Women who are pregnant smoke. Many of them drink. Many of them use drugs. And so they're late in getting the care they need, and the babies don't do well. Alcohol, drugs, all of this causes infant mortality. Infections, they don't get checked. Many women have high blood pressure from eating the wrong foods. Again, pork, salt, fast foods, junk foods. And so other things are their blood sugars. They know they're feeling drowsy and sleepy all the time after they eat, but they don't even realize they have diabetes because they never went and got it checked. Okay? So it causes problems for the fetus. How do we improve? We improve through education and nutrition, talking to these young people to, first of all, concentrate on your priorities in life, and that is to get an education, finish school. Right now, every day in the United States, 7,000 teenagers drop out of school. 7,000. That's a serious problem. We have got to develop programs in our communities. Some of them call them choice programs, where you get some kids who have dropped out and then turn their life around to come and talk to other kids who are still in school so they stay in school, to let them know that's a bad decision. Now, in the state of Georgia, which is a third item on my agenda, which is really stupid, I don't know where they came up with this law, but when you turn 16, you're considered emancipated. which means you don't have to listen to mom and daddy no more. If you want to get pregnant and go out there, if you want to drop out of school or whatever, nobody can keep you from staying in school. And I know back in the olden days, in the early 1900s, kids used to have to come out of school to help work on the farms, in the fields. We don't have that anymore. We have machines to do those kind of things. So the law still exists that you're emancipated when you're 16, so you don't have to go to school anymore if you don't want to. So we see kids are dropping out as soon as they enter high school. Many of them 9th and 10th grade. That's the average age of the dropouts. So we've got to get to them before they reach that age and keep them in school. So we don't have that going on in Albany, Georgia and Southwest Georgia. So the root causes of healthcare disparities: employment problems, not having a job, not having the education, living in poverty. And I'm sure if you go around in this community, because Albany has one of the biggest poverty rates in Georgia, unfortunately. You drive around here, you'll see some really sad areas. And we can't just be blind to that. We've got to do something to help these communities. You have to get with your churches, whatever it takes to help your communities get back. When I moved to Cairo, Georgia, when I finished my training, I was right here in Albany, did my residency in family medicine, and it was the first class to graduate at Phoebe Putney. And I was the first black. And I went back to Cairo, Georgia, which is where my family roots were, even though I didn't grow up there. They had no black doctors, no female doctors. And I rode around into the community because I wanted to get an assessment of what's here and what's not here. And I was shocked to see how people were living. Many of them had little or no water, dirty water. One family was so poor, they didn't have running water inside, but they had a faucet outside. So what they would do is take a water hose and they would use that to fill the little sink up in the kitchen to wash dishes. And they'd use that to put water in the toilet from the water hose now. When I saw that, I said, I've got to do something. You don't need a whole army to make a difference. Each of you sitting here individually can make a difference in your community. So what did I do? I started a Habitat for Humanity by just talking with people in Tallahassee who already had one. I said, what do I need to do to get it going here? Thank God, Rachel Robinson, Jackie Robinson's widow, who was a cousin of mine, she sent me a donation for the first house because she wanted to see something happen better for Cairo. People are out there to help. All you got to do is ask. Ask. Don't just sit there and think, oh, I can't do it because I don't have the money, I don't have the time. Do what you can do. We built that house, and we built many other houses after that when people saw what we were trying to do to help the poor. So we have got to help our brothers and sisters. Healthier lifestyles we have got to adopt, changing our diets, folks. I've lost 62 pounds. You all can't tell it, but I have in the past year, and I'm going to continue until I get down to goal. So I myself as guilty as some of the others, but I'm working on it. We need health equity. We need to get rid of these disparities so that people don't look at us by the color of our skin and say, well, I'm not going to do as much as I'm going to do for this person as I will for that person because they're this or they're that. Okay. How are the disparities being measured? By social and economic well-being, health status indicators, as I mentioned before. We must have health insurance. As I told you, November the 15th, the insurance marketplace with Obamacare will start enrollment again, so you can get enrolled if you don't have insurance. And the professional workforce, that is the physicians and nurses. Health is a state of complete physical, mental, and social well-being and not merely the absence of disease. Just because you have health insurance doesn't mean you're healthy. Okay? I know a lot of people now who have health insurance and they can't use it because they can't pay the premiums. They have the insurance, but they can't pay the deductibles. The deductibles are so high. Every time they go to the doctor, they have to pay out of pocket until they meet that deductible, so they don't go. Of all the forms of inequality, as Dr. Martin Luther King stated, injustice in healthcare is the most shocking and inhumane. So we've got to educate our communities about the problems in healthcare if we're going to make a positive impact with our patients and eliminate disparities. Health is a basic human right, and we all should have the same opportunity to live our lives no matter what our race is. Yes, it does take a village to make it happen. We have to collaborate with our communities and healthcare providers, hospitals, churches, our local government. Be politically active. You go to the polls and you vote for these politicians and you don't see them anymore till the next time to vote. Talk to them and let them know what's going on in your communities and how they can help you when they go to the Capitol in Georgia, or when they go to Washington, D.C. Many of them are lawmakers. They help make these laws. So if you don't let them know what's happening in your community, it's going to stay just like it is. Sororities, fraternities need to start mentoring more. Risk factors, I mentioned many of those things before. We may have come here on different ships, people from different races, but guess what? We're all in the same boat now. Health literacy, understanding what is being said when you're being talked to, why the treatment is being recommended, who's requesting it. And yes, I talk to many physicians about the same topic because many physicians are the reason why there's so many disparities. They're not doing what they need to do. I had a patient come to me the other day who was a veteran, and he had been going to the Veterans Hospital in Dublin. And when he came, he was in tears after our visit. And I said, well, what's wrong? He said, Doc, you just don't know. He said, you're the first doctor I've been able to sit here and ask questions and understand everything you've said to me. He said, no doctor has ever taken that time out. And he had me almost in tears. And he left out of that room smiling. And I said, look, we're going to take care of you. And if any of you are interested in the health field, I'm going to give you this advice. When you encounter a patient, handle that patient just like you would a family member. And I guarantee you, you'll be successful. Weapons of mass destruction, fast food. That's what's killing many of us. Young people are dying as well. Too much fast food. I mean, what sense does it make when you go to McDonald's and you get a quarter pounder with cheese, some French fries, and a Diet Coke? I don't quite understand that. You're defeating the purpose. So let's change our habits. Helping with inadequate housing, getting people to get that education, changing their lifestyles. Spirituality is very important in life for all of us. If you're not spiritually grounded, if you're not believing in some higher being, for me it's Lord Jesus Christ. If you're not connected with some type of entity or church, praying on a daily basis, reading your Bible, life's going to be real tough. That's all I can tell you. It's going to be tough. I can say out of 23 years of practicing, I've had very little stress in my life. I begin every day with prayer with my staff, and I end every day with prayer. Now, if they don't want it, that's their business. But I'm going to pray before I get in and start seeing my patients. And yes, there may be little issues that come up, but they work themselves out. Okay? So if you're not spiritually grounded, because one thing I'm noticing today in this world, that very few young people do I see in many churches anymore, especially the traditional churches. You may see them in all these non-denominational churches with the praise and worship and all that. But like the Baptist churches, the primitive churches, the AME churches, you don't see many young people. So I don't know whether they're going to church or whether they're just going somewhere else or not going. But I'm just letting you know, you gotta get your spirituality in check. Working conditions, definitely. You want to be able to work. Many people who have problems with healthcare disparities, they work in poor environments. They live in poor environments. Some of them live next to landfills. Think about it. Some of them live in agricultural areas where there's a lot of farming going on, where they spray a lot of pesticide spray. Southwest Georgia is one of the worst places when it comes to cancer. High rate of cancer in Southwest Georgia. There's a lot of agriculture here. And I've told them, I said, look, we need to do something about this in Georgia to help these people who live in these rural areas where they're spraying all these sprays to kill the bugs so they can grow the crops. People are inhaling that stuff, and it doesn't always have a scent to it, so you don't even know you're inhaling it until it's too late. Okay, so we got to work on these things. Solutions, as I mentioned to you before, we've got to reach out and get involved in our communities. We've got to increase the pipeline of physicians of African American and Hispanic descent. We've got to get more of them into the medical field. Without them, many of our patients are going to suffer. Many of our patients won't live very long. Improve the land use, have affordable and safe and clean air and water. And we already talked about some of the leading disease killers for people who have these healthcare disparities. In certain neighborhoods, danger from crime. We need to have the neighborhoods protected better. Don't let people come in your communities who don't look like you and do whatever they want to do. If you have to get a community group together, if it's just 3 or 4 of you get together, go down to the courthouse, to the commissioner's meeting, or wherever you need to go and protest when you see things are coming in that community that shouldn't be there. Many times there are billboards that are put up in your communities. And what are they promoting? Tobacco. Oh, they put a beautiful person up there with a nice long cigarette, looking good, and it makes these young people want to emulate. Because see, young people, when they grow up in these communities, they're exposed to this every day. So that's all they know. They said, oh, well, I want to look like that, so I got to get me a cigarette. No, you don't. So let them put up other billboards that are going to promote health, healthy lifestyles, living longer. Okay? So as I mentioned, building more collaboration in our communities, building trust. We have got to start trusting each other and trusting our healthcare providers, and we've got to get our healthcare providers to do what they need to do for our patients so that they will trust them. We've got to get rid of many of the things that we experienced, or our families experienced years ago with the treatment that they got or did not get when many of them died prematurely because no one took care of them or no one treated their illness. So many of us grow up ingrained within us saying, well, if that happened to mom, it could happen to me, or if it happened to grandma, it could happen to me. You got to kind of let that go. Make changes to your community environment, have incentive programs, promoting cultural competence and diversity, strive for health equity, so that each of us has the opportunity to obtain his or her full health potential, and no one is disadvantaged. Health inequities are reflected in differences in life, the length of life, the quality of life, the disability, death, and severity and access to treatment. So people, we have got work to do in Southwest Georgia. We've got work to do here on Albany State. I would love to see a campus disease-free from sexually transmitted diseases, from HIV/AIDS, whatever it takes, from obesity. Let's start walking more, exercising. Let's stop eating out all the time. Let's make better decisions when we do eat out to not eat the foods we know we're not supposed to have, okay? And let's educate our families. You all are here not just to get an education, but you have to remember you must give back what you get here. And that means going back home to your communities and educating them about what you know is going to be best for their life, for their health, so that we all live healthier. We all are happier, and we live longer. Thank you very much. At this time, I'll be glad to entertain any questions. Yes, Gentleman in the back? Mm-hmm.
I have to.
Well, that's why I stress the fact that African American males have the shortest lifespan. Is because they wait until it's too late, until they're about to die, before they say, oh, you got to take me to the hospital, or you got to take me to the doctor. I usually have to talk to their spouses or their significant other just to get them to come in to see the physician. So if we don't start talking about it more, it's not going to change. And it's going to take men like you and others in this room to make it change. I can't do it by myself. Everybody in here has got to say, Dad, when was the last time you saw the doctor? Oh, I don't want to talk about no doctor. Well, Dad, I think you need to go see a doctor. You need to get checked out. At least get a physical if you don't get nothing else. You know, they'll listen, most of them will listen to their children. So if you don't take the initiative to try to do something to get your father, grandfather, aunt, uncle, brother, husband, you name it, significant other, to do what they need to do, it's not going to happen. I had a patient come to me 15 years ago, and his wife brought him in because she was coming to me, and she said, Dr. Wall, I want you to see my husband because he's losing weight, and I'm worried about him. You know, he was a football coach at a high school. So she brought him in. Sure enough, I did my exam and history. Listen, listen, listen. Always listen to your patients because they can tell you a lot before you even have to diagnose. And just listening to him, I was concerned, could he have cancer? Could this be? Did one test, just one, besides all the blood work. And sure enough, he had renal cancer, cancer of the kidney. This man is living 15 years later. He had that kidney removed. We caught it early because had we waited 10 more years, he'd been gone. Okay, so we got it out. This has happened with many of my patients. When you catch things early, when you're diagnosing it early, people live longer, they live healthier. So even though you may feel bad, don't think it's the end of the world that you're going to die. And many men say, oh, well, I've got this, so I'm going to die with something, so I might as well die with this. I ain't nothing else. I don't need to go to a doctor about that. And that's the excuse a lot of them use. But that's not true. People live much longer now. Yes, we see these chronic diseases because people are living longer, but they're being managed better for those who take care of themselves and do what they need to do. Now, you mentioned something else about, what was the other thing you had? You mentioned a couple of things. Oh, I know what it was. Yeah, you were talking about that in terms of running in the family because dad had it, mom had it, I'm going to have it too. No, 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 no. You have to break the cycle, okay? And by breaking that cycle, it will help you to live longer, healthier, and do much better overall. That is getting treated for whatever it is. Because see, like I said, this person that died today was found dead here in Albany. 43 years old. He could have had a good life, but his pressure wasn't controlled. And let me tell you another thing. Many men don't like to go to the doctor because if they find out they have high blood pressure, they don't want to be put on certain medicines. Because they know that medicine is going to mess with them in a sexual way. They'll be impotent. But not all of them will become impotent. And there are so many medicines out there that don't affect your sexual performance. So that's another myth that we have got to break. We got to stop that myth that, oh man, you get that medicine they put you on, you ain't gonna be able to do nothing. You know, that's one reason why a lot of them don't come. And it's a big one, really, to be honest with you, because I have to address it. When they come in, I say, you've got high blood pressure, and let me tell you something. The medicine I'm going to put you on, don't worry. You're going to be all right. It's not going to affect that part of your body. And they know exactly what I'm talking about. And they smile and said, okay, doc, all right. I said, I want you to take it now, and I want to see you back in a week. You know, so we have just got to talk about it more in our families. When you go home for Thanksgiving, go home for Christmas, you know, talk to your families about these things. Getting that checkup, getting checked out. Make sure they have their colonoscopy at 50. Some people may need to have it earlier than that. Men need to get their prostate exam. No, I don't want nobody putting their finger in my rectum and all this crap. Hey, prostate cancer is higher in African American males than any other ethnic group. So get the prostate test. There's a blood test too, but The digital exam is the most important thing, okay? Women, get your mammograms when you get of age. If you have breast cancer in women, there are a lot of black women that certain breast cancers of a certain strain run in their family, and it will kill them in their 20s. So if you know anybody in your family who died young of breast cancer, you need to go see a doctor and let them know so they can get you screened and get your mammogram done early, okay? Yes. Monitoring, you mean monitoring that? Yes. No, because I've discussed it with state officials about it, and no one has been able to share anything like that with me. But if I do, I'll be glad to let someone here know so that they can share it with you all. Yes. And as I mentioned about HIV/AIDS, and I know when they have those screening tests, a lot of people, you know, they kind of, I'm not getting no AIDS test, I don't have no AIDS. You don't know what you have until you get tested. But we really need for all African Americans to get tested. Because as I mentioned to you, there are over 1 million cases and half of them are you all. And the sad news is there are millions more people out there who have the disease, and they're constantly spreading it because they don't know they have it. And some of them do know they have it. And I've seen cases where people who get it from someone else that they trusted, sometimes they're their spouse, that they get so upset that they said, I'm going to deliberately infect as many people as I can. And see, they don't get caught. I've had the worst case was a couple, they met at a game, they had a one-night stand at a hotel, and when the gentleman got ready to leave, he left a little miniature casket sitting on the dresser counter there at the hotel. She was still asleep, and he left a little note. He said, "It's been nice knowing you. Welcome to the AIDS world." He gave her a false name so she couldn't find out who he was. Because whenever you infect someone deliberately, you go to prison. Okay? And he didn't tell her, so now she ended up getting tested, sure enough, and she had AIDS. This could happen to any of you. If you don't have protective sex and make that person put on a condom, and I don't care what he says, if he says, why you want me to wear a condom? You must have a disease. And see, a lot of people give you that guilt trip that you got something you don't want to give. No, I don't have anything. Well, then I don't need to wear a condom. If they don't respect your wishes and put on that condom, you better leave it alone. Yes. Oh, sure. I'll do whatever I can. Because, you know, I have reached out to people, many people of key positions who want to see something happen, but they're not getting the support from local people like me and you. And so when they see us out there trying to do something, they will pull us and say, come on, we need you, we need you. So hey, I'm here to help and do whatever I can. Because if we don't talk about it and we don't change some of the things that are happening by discussing it and making it known in our communities, guess what? It's going to stay the same. Nothing's going to change.
There was a project that was done up north, University of Pittsburgh, which is now transferred over to the University of Maryland, which is the Healthy Black Family Project. And the folks who did that project are looking at a Deep South partner. So that's one thing that we want to explore. But we need some community partners, particularly in rural areas. Yeah. And I think your organization.
Well, we would be very, very happy to support you. And I want to say here in Albany, I'm the founder and past president for the Griffin Jordan Medical Society. Dr. DeVale Young, some of you may know, he's the president of the organization. And we are trying to see what we can do in our communities to make a difference. So this would be one item that we would definitely like to work with you about, and seeing what we can do, So just we'll talk and exchange numbers and stuff. But young people, just because you're in college doesn't mean that you don't have to do anything. You are challenged to make a difference right here on campus. There are so many young people around here going to school that are stressed out. They come from abusive homes with a lot of domestic violence. They're not telling you about what's going on back home or what they're dealing with. Many of them are stressed out. So, you all need to be mentors to your colleagues, okay? And help them along. Try to encourage them and let them know there's help. You know, I'm sure they have places like you have a social worker here, you know, that they can go to and talk to get advice. You know, utilize the services. You've got Dr. Daisha Berry, Mrs. Berry back here with Student Affairs and many other instructors, Dr. Rosenbaum, and many others. Utilize the services these people, that's what they're getting paid for. Okay? Mr. Pierce and others. Okay? Well, I wish you all much success in all of your endeavors. I don't know how many are here and interested in medicine, but if you are, I'd be glad to talk with you more because we really, really want to see our African American young people do well. And remember, when you get there and you get that diploma and get that degree, don't forget where you come from. Don't get the big head and say, oh, well, I don't need y'all no more. It is your responsibility to give back. And don't expect something every time you do something, okay? All right? God bless all of you.